You're tuned to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on 101.7 FM WCZR Real Radio, and then this is also podcast on Spreaker. Jeannie Roller is my co-host. She's with me from Indiana. We have Dr. Rich in the studio with us again. I mean, thank goodness you're here, Dr. Rich. I want you to just stay here so I can ask you 800 questions, and every appointment I go to, I want to just get you on speed dial and ask you, because it's making so much sense to us of like, yeah, where is this, all of these guys? So Dr. Rich is a concierge doctor now, but you are a primary care doctor. You're a GP, we called it in the old days. So Jeannie Roller, you got a couple of questions, a couple of observations that are just fabulous, and I want you to run with it. Go ahead.
Well, number one is I liked it when Dr. Rich talked about, rather than working on the computer, he's able to have conversations with his patients and look them in the eye. So many times nowadays you can't get a doctor to look you in the eye because they're busy inputting into the electronic medical records. The second point I liked is he said he wants to make decisions with the patient rather than for the patient. That, to me, so many health providers seem like they are making the decisions and the patient must follow them. And the third thing is is that when you go to the hospital, you're sick, you're in a new surrounding, a strange surrounding, it's scary. And to have your doctor, Dr. Rich, come in and kind of navigate through the system for you and with you, I imagine that takes a great deal of stress off of the patient. Have you ever had any feedback about that, Dr. Rich?
Yeah, Jeannie, thank you very much for all those questions and comments. Communication is actually something that's incredibly important when you're developing a therapeutic relationship with a patient. So, there's actually been research about how we communicate the best. We think that the words we say have the most impact, but that's really not the case. Our tone of voice actually makes a huge difference. Mm-hmm. So, the way we say things can make a huge difference in how people take what we say. And if we're not careful, people may misinterpret what we say because we use the wrong tone of voice. But body language is actually what matters the most. Mm-hmm. And if I sit down with my patient and we're looking each other eye to eye, and I'm looking at the patient's facial expressions, and I can tell, not completely accurately, but I can tell when I've maybe touched a nerve, or maybe I'm giving too much information too quickly. And so that paying attention to my patient's body language as well as paying attention to my body language can make a big difference in communication, building a trusting therapeutic relationship with my patients so we can work on health together as best we possibly can.
And that's a good point there, because we've talked about that many times, Jeannie, you and I and other people on the show, that do we know, again, you and I are not doctors. Dr. Rich is a doctor, okay, Dr. Rich Widerski. They think maybe they're giving us too much information because they don't really know us. So how do they know what our tolerances are? But if you have that family, relationship with your doctor, then he's going to know, or she's going to know more about you to know what to tell you and what not to tell you.
Yeah, and that's important because, especially some doctors use a lot of jargon. We go to this medical school to learn this foreign language of medicine that nobody else understands because they haven't been to medical school for 4 years. So I try to use non-technical terms, try to use as much just plain English to communicate things to my patients. So we're using the same language. But also to not give too much information too quickly, because, whenever you're given a lot of new information, you're trying to kind of digest all that information. Right. So we have to be careful not to overwhelm our patients. Something that's second nature to us isn't second nature to a patient that hasn't done the same amount of study in medicine that we have.
Bingo. I mean, you're hitting all the points we've talked about so many times. What else, Jeannie?
Well, you say you're in direct primary care. Do you have any idea the percentage of doctors that are participating in this nationwide?
That's a great question. And in fact, there's some concern about physicians going into direct primary care and concierge care to reduce the number of patients that they see. because our medical workforce is already in a shortage, and that's projected to become even worse over time. And this isn't just true of physicians. This is nurses and other professionals who are just getting burned out. In fact, the burnout rate for physicians during COVID was about 60%.
Wow.
Where, the physicians just, at least at some points of the day or of the week, just really didn't have their heart in taking care of patients. That's much, much higher than it ever used to be. It's still at about 50%, which is much higher than it ever used to be.
Yeah.
But that burnout is in all the medical professions, and people are retiring early. It used to be physicians and nurses, would work into their late 60s and into their 70s.
Right.
And many are looking forward to seeing how long they need to stay in their profession rather than loving what they do for many, many years.
Well, you're human beings at the end of the day. We're all human beings. I mean, doctors and nurses are too.
Yeah, and there has to be balance in life. And this isn't just true of medical profession. That's true of everybody. And if we live to work, we miss a lot of other things in life that are very important in life. And I think more and more people realize that the chronic stress actually affects the health of medical professionals as well. Again, not just doctors, but all medical professionals.
Right.
So everybody needs to have balance to take care of themselves, to take care of their families, to have a social life that's an important part of just maintaining cognition. If all we do is work, it's not good for our health in many different ways.
No, well, I mean, it's a quality of life for everyone. I mean, and isn't that what everyone wants to have across the board?
Yes.
I mean,
And I think my patients want a physician that has their heart in it, that truly cares. And I think almost all physicians truly care.
Right.
But if you're burned out, you're no longer enjoying and caring, you're going through the motions to check the boxes, and that's not the way to practice medicine.
Right. And we all can agree on that. And also, like you've said so many times, the communication and the trust is unreal. That's our, word, trust, that we can do that. Jeannie Rolla, we got like 2 minutes left. Another point?
Well, another point I want to clarify. At first, I was confused when I first started hearing about this, but correct me if I'm wrong. You can still have private insurance, Medicare, Medicaid, and still see a direct primary care physician, because that doesn't exclude you having private insurance. You just pay separately for your services. Am I correct?
That is exactly correct. In fact, it's important to maintain regular health insurance too, because that covers for, if you're in the hospital, it covers hospitalizations and outpatient surgeries and in some cases, medications, like Medicare Part D, for example. So all those things are not covered. It just covers what the physician does for the patient within the parameters of that primary care practice. But there are so many other things that we need in healthcare, even just like, getting physical therapy, let's say.
Right.
That's something that's a billable Medicare and private insurance service. And although I can order it, I'm not paying the physical therapy company because I wouldn't be able to afford that.
Right. Well, it's a different setup. For
my patients. So my patients do need insurance for all kinds of other things. But the fee that I charge, that our practice charges, takes care of everything that we do for the patient.
Right. So there are different, Jeannie, this fabulous question, there are different levels. That's what Dr. Rich was explaining on a previous podcast. Some doctors still in concierge have bill Medicare, Medicaid, and insurances. Some do not. You have to look into all of that. And I think across the board from the shows and stuff and the doctors that I've met is you keep some kind of catastrophic insurance or those kind of insurances along with this care. This is your primary care that we're talking about, which to me is the basis of it going forward, most importantly.
Yeah, absolutely. So as another example, we do preventive care, but when somebody needs let's say a preventive screening colonoscopy, well, I refer that to a specialist to do, but I order the referral and the colonoscopy to be done for screening purposes.
Right. So on that note, I'm going to say stay tuned to Planet Vero Radio. Look at concierge medicine if it's in your area and ask the questions and keep the communication going so we can keep the trust going and so we can keep the good care going on both ends of the spectrum. Stay tuned to Planet Vero Radio.